Hi, I'm Dr. Brad Shook. I'm a board-certified chiropractic physician with advanced training in functional medicine, and I'm here in Hickory, North Carolina. And today I want to talk to you about peripheral neuropathy, and in particular, diabetic peripheral neuropathy. So if you're not familiar with what neuropathy is, it's when you have damage to the nerves of your body, and it can create a lot of uncomfortable sensations. It can create a lot of different problems depending on the person and depending on what nerves are being affected. Very commonly we see that people have experience of pins and needles, or typically it starts in the feet. Neuropathy is, the most common cause of neuropathy is diabetes. Diabetes and blood sugar spikes that are an elevated blood sugar for a prolonged period of time damages the nerves. It damages the blood supply to the nerves, and the nerves start to die. And when they start to die, they start to express a lot of uncomfortable sensations. And I guess the most common thing that we see are pins and needles in the feet. Usually it starts in the feet because the nerves that feed and that go to the feet are the longest nerves in your body. So the longest nerves get affected first. And as those nerves start to die, what you'll see happen is you'll get, a lot of times it varies depending on your particular, the nerve endings that are being affected by your diabetes or whatever driver of neuropathy you have. It will cause a problem with the perception and the sensation of the nerves. The most common symptom is pins and needles, where it feels like you have, sometimes like people will say bugs crawling or little pins and needles all over their foot, like their foot, has your foot ever gone to sleep? If it has, then when it wakes up, it can be this very uncomfortable feeling, and you want to, hit it, touch it, rub it. Well, imagine if that were happening 24/7, all day long. That's what some diabetics experience, and that's what some people with neuropathy. And there are other causes of neuropathy, but I'm referring to diabetics because it is definitely the most common cause. It's the high blood sugar, damages the vascular supply to the nerves, and they die. Also, you can experience numbness. You can experience like almost a burning sensation. People feel like it burns. So there's a lot of different sensations. Ultimately, some of the bigger problems. The sensation issues are terrible for quality of life. They can make sleeping very, very difficult. But ultimately, the biggest risk factor is that we have risk of falling, because when you can't feel your feet, you can't balance. And that's really the biggest issue here. So diabetics have this high occurrence of neuropathy. And in our office, we utilize a multiple therapeutic approach. And what that means is we utilize a lot of advanced therapies that have been shown to help with improving circulation, improving things like nerve growth factor that can help with the neurogenesis, or the improvement in growth of nerves and the branching of nerves, and decrease pain and decrease abnormal sensations that are associated with neuropathy. But listen, when you have neuropathy, you can't just approach it from a therapy perspective. You have to look at the metabolic health of the person. So what is your biochemistry? What is actually causing and driving the neuropathy? And if it's diabetes, then we have to take an approach that is nutritional and temporary nutritional supplementation to support optimal blood chemistry and give you the best chance of healing. Because you can't continue to have high blood sugar and prolonged problems and expect the neuropathy to get better long term. You can't do it, because you've got to address the cause. So what we do is we do anywhere from just a little bit of testing to very, very extensive testing to dig and try to help you improve your quality of life and improve your quantity of life and help you with your neuropathy. And then what we do is we try to layer in this metabolic approach, this biochemistry approach, using functional medicine, which is something that I have extensive training in, and we utilize a therapeutic approach. Some of it can be done in the office, some of it can be done at home. And we do work with people all over the country. So, we might be able to help you determine what therapeutic approach is appropriate to use at home, and work with you to help get the appropriate testing, establish the appropriate diet, and determine the appropriate nutritional supplementation that you would use temporarily to support your diabetes. We've worked with people that have diabetes, type 2 diabetes, a lot, and we have taken A1C, hemoglobin A1C marker, and if you have diabetes, you know what I'm talking about, what that is, taking that down from over 11 to a normal number within 6 months. Within 3 months, we had it below 6. So there are a lot of things that you can do naturally, but you have to be willing to change your diet. You have to be willing to take temporary nutritional supplementation, and you have to be willing to do things consistently. If you're not ready to do that, then I can't help you. Okay, so just know that. But if you have peripheral neuropathy, We work a lot with it, but the most important thing to understand is you cannot just typically treat the neuropathy itself. You have to understand what is driving the neuropathy. You have to try to look at the person's biochemistry and see if there are deficiencies, see if there's a blood sugar related issue, see if there are metal exposures or toxicities, and you've got to work on addressing those problems while you're working on a therapeutic approach to help the neuropathy. So I hope this helps you better understand a very complex topic in neuropathy, some of the things that we can do for it. You know, we use laser therapy, red light therapy, infrared, we use peripheral nerve rehabilitation therapy. We do a lot of different things that are really advanced therapies that you probably have not heard of and your doctor's probably not familiar with either. But we've used those to help people with neuropathy. If you'd like to learn more about what we do, you can visit hickoryspine.com. Just click on Diabetic Peripheral Neuropathy page, and you can read a lot more about the approach that we take and what we do. If you'd like an appointment or a consultation with me for neuropathy, just give us a call at 828-324-0800, and my staff will be happy to help you out. But I hope this helps to give you a better idea, again, of a very complex topic, lots of different causes of neuropathy, lots of different ways we have to approach it. But the most important thing I can tell you is this: you've got to approach it from multiple angles. You've got to approach the biochemistry that's driving and causing it, and then you've got to approach therapeutically. And there's different circumstances because there are a lot of different causes of neuropathy. But we'll be happy to help you out as much as we possibly can to give you better quality of life, and then help you with improving your length of life as well. So I appreciate you. Hope this helps. And if you need anything, please do reach out to us. Thank you.